people say that they have vertigo, they may oftentimes misinterpret what that actually means. A true sense of vertigo means that the person feels like they are actually experiencing some spinning, and it makes it very difficult for someone to actually get up or to even open their eyes. And when it comes to vertigo, vertigo does tend to happen with the inner ear. So we're talking about disorders that can include crystals inside the inner ear, like benign paroxysmal positional vertigo or BPPV. We could also talk about inflammation around the nerve of the inner ear, like vestibular neuritis, or even diseases like Meniere's disease or other rare forms of inner ear disorders. So all of these can cause vertigo, and an ENT can perform testing that will actually see what the function of the inner ear is in these types of cases, and the diagnosis can be accurate. However, a lot of people think that they have vertigo when in reality, they may be experiencing dizziness in the form of something called disequilibrium. When people feel dizzy, it can mean that they just feel a little bit off balance, or it feels like that their head just doesn't feel right and it feels like it's kind of moving. They could also feel just an overall feeling of a sense of imbalance or a feeling of disconnection from their body. So when people say that they feel dizzy, then it may not show any positive signs on an inner ear test, and an ENT may say there's nothing wrong with your inner ears, we don't know why you're dizzy. But dizziness can be triggered by other systems besides the ear. It can include any part of the body that is involved with the detection of motion of the head, and it can also be involved with any part of the body that detects the position of the head. So this can mean that there's something wrong with the sensitivity of your eyes. It could mean that there's something wrong with your neck, and you could have cervicogenic dizziness. Or you could even have problems inside the brain, and that can be a result of a problem like a migraine or a vestibular migraine. Or even something like traumatic brain injury can make people feel quite dizzy without actually damaging the inner ear. So there's lots of disorders that could actually make people feel dizzy or off balance. And in order to get an accurate diagnosis, we can't just focus in on one specific area of anatomy, meaning that if we are only looking at the inner ear, unless we're sure that you have vertigo, we're missing a big part of the clinical picture. What we do in our office, we actually look at all three systems that provoke dizziness. That means we're going to assess your brain, we're going to take a look at your inner ear function, and we're also going to take a look at your eyes and your neck. Because if we can find out where there's dysfunction, then we can put you on a road to rehab in order to fix some of these problems and restore your sense of balance. So if you ever have problems with your sense of equilibrium or your sense of balance, or you're experiencing symptoms of dizziness, and you're not getting answers from just people looking at the function of your inner ear, then it might be time to explore not just the